Keiser that day that was made talking about Governor Greg Abbott, where they were closing down the bars again, and they were going to make that the decision for the restaurants and everything else. Dr. Keiser, how you doing, first of all, this morning? And then what have we seen change in the last 2 weeks?
Yeah, well, needless to say, we're very busy. And what we've seen is the numbers have gone up quite a bit. But we've also seen some changes taking place both in government regulations and people's behavior. So, the first thing I think is Governor Abbott closing down the bars. I think that helped a lot. Most of the cases that we had been seeing over the past couple of weeks was in younger people. And so people who think, well, I'm young, COVID's not going to affect me, I'm going to go out and have a good time. And they've been actually getting infected. And the problem isn't so much that we're seeing those people get really sick. Some of them do get really sick, but the real danger is that they take it home to their family members, and they take it home to parents and grandparents and people who are at risk, and even kids. There are some kids who do get sick from this. And typically what happens is one person goes out and gets it, they take it home, and they have a Memorial Day or Mother's Day or some sort of celebration, and then everybody gets it. And we're seeing that over and over and over again, where people are bringing it home, and with that, seeing some folks going into the hospital. So that's the bad news. The numbers continue to go up. But we are seeing kind of a change in the trajectory. So, for example, 2-3 weeks ago, it was going up like a rocket like this, and now it's beginning to edge off. So I'm hopeful that everything that everybody's doing and wearing masks, and businesses requiring people to wear masks and social distancing, and people just being more aware, I'm hopeful we're beginning to see some effect in that.
So you think the governor's decision, along with people saying this is serious, it's having the positive effect, hopefully, that we want?
Yeah, I sure hope so. And it's still surprising to me that people don't think this is serious. When we saw the numbers go up, it was just like, well, it's all old people, it's all young people, and it only affects older people. And then when we saw hospitalization rates go up, we go, well, it's just in the hospital. It's not. It's not increases in the death rates. And now we're seeing people getting on ventilators, and our ICUs are getting full. And we are starting to see increased deaths. So, we're in it. We're in the thick of it right now. And we need everybody to do their part. And I understand that some people don't like wear masks, and some people feel like it's an imposition on it. But come on, it's only a mask. It's not like, we're taking your house away or we're putting you in prison. It's wear a mask, be respectful of other people, keep your distance, show respect for yourself and for others by doing this. And I think that'll help get us through it.
I've seen some people say they feel like that's infringing on their freedoms. What would you say to that?
Well, I understand why they say that, but you wouldn't walk into a business and drop your pants and pee on the floor, right? If you did that, you'd expect to get arrested and kicked out of there pretty quick, probably pretty violently, too.
I have some friends that probably have done that, but yeah, you're right on that.
Right. Sure. Right. But there are norms of behavior. Mm-hmm. And now what we're in the middle of is changing our behavioral norms. And I understand that sometimes wearing a mask can be uncomfortable. And I understand that sometimes you forget. And sometimes my wife has to remind me. I'll get out of the car without mine, and sometimes I have to remind her. That's all normal, but we have to get to the point where we're really thinking of this as part of our normal attire. And once we do that, I think things will go a lot easier. It's only a mask. It's not a lot of other things that people have tried to make it equivalent to. So we're really pushing people to wear masks, and asking people that even if you don't think it's serious, just go ahead and do it anyway.
Okay. So I saw a post that the Galveston County Health Department put out where it says the numbers from June 8th to July 8th, that we're heading in the wrong direction. Can you explain, I guess, those numbers from June 8th to July 8th?
Yeah. So in the beginning of June, we had a little over 1,000 cases. And now in July, after the first week of July, we have 5,000 cases. We just crossed 5,000 cases. So we had 4,000 cases in 1 month. That's absolutely astounding. That shows how fast things are growing. And then on the island of Galveston, it went from 92 cases to over 1,000 cases. So what that tells us, the virus is here, it's circulating very rapidly, it's infecting a lot of other people. Our best guess is anywhere between 10 and 12% of the people walking around have it. So just think about that. Think about that as you're walking around in a store or even walking around in the seawall, and just count, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Nope, you passed somebody who has it, and if it gets up to around 12 or 14%, we'll just say 1 in 8, and 1, 2, 3, 4, 5, 6, 7, 8. You've passed somebody who's had it. The other thing that we've come to realize is that there's more aerosol spread than we realize. So, we've been emphasizing, worry about people coughing and all that stuff coming out of your nose. But there are people who it just kind of floats out and floats around. And if you just happen to walk by that person at the wrong time and take a deep breath at the wrong time, you're going to get infected. So this is why wearing masks is so important.
Wow. Yeah, I hadn't even really heard that part yet. So just wearing a mask protects. And then I've seen some people talk about the cloth mask. Well, they think it's really not helping as much as the other ones.
Yeah. Yeah, well, no, that's true. I mean, there are masks and there are masks. Probably the best thing to do would be to wear what we call a papper, which is a helmet that fits down over you and it's got air blowing everything out. That's the best thing. And we use that in people that have Ebola and other types of really, really infectious things that are very deadly. And then there's the N95 mask that fits tight around the face. That's we're reserving that for the doctors who are actually seeing the sickest patients. But for the most part, any type of covering helps, okay? And so whether that means wearing a surgical mask, wearing a piece of cloth around your face, some people are wearing, sunscreens that they wear when they go hunting or fishing. Anything is better than nothing at this point. And so the more people we get to do something, the better. For those of you who want to make your own masks, it's actually easy to do. There's lots of instructional videos online. You just take an old t-shirt and the cotton is the best, and cut it so that you have double barrier. You don't need to put anything else inside, and wear that. And that is pretty good. Even with a cotton mask, if everybody wears a mask and keeps their distance, the chance of getting infected drops dramatically.
Dr. Keiser, before we went on air, I shared a little bit of the story that I've been living through right now. I've been in quarantine for 2 weeks as my wife had tested positive. Coming out of quarantine, what is the best advice for people? Like, I never showed symptoms. I actually tested negative.
Right. Right.
So if somebody never showed symptoms, maybe they never got it.
Right.
Even if someone did show symptoms, coming out of quarantine, what's the protocol? What do we do?
Yeah, so basically we have what we call the 10 and 3 rule, okay? So 10 days from the day that you either have your symptom or your test, okay? So let's say you get a test in your case. You're asymptomatic, you get a test, so we count for 10 days from that, plus at least 3 days without having a fever, okay? And so in someone like you, that means after 10 days, you're probably okay. You don't need to stay inside. If you started off with no symptoms, but then you started developing symptoms, that's when we start counting. So let's say you get your test on Monday and Wednesday you start having a fever. Well, that Wednesday, that's when we start counting that 10 days. But we count that 10 days and we want your symptoms to go away for 3 days. And the main symptom we're focusing on is fever. So there are some people that still have some fatigue and they just feel bad, or they may have a sense of fever, that sort of achy feeling that you get when you have the flu. But if you take your temperature and your temperature is normal, that doesn't count. So once you get past that point, then as far as we're concerned, you're okay and you're no longer infectious. We know this for 2 reasons. One is that the United States Navy studied a bunch of sailors that were on the Theodore Roosevelt, and they found that after about 10 days, nobody infected anybody else. And then in South Korea, they actually tracked down a bunch of people who had 2 positive tests. They had a positive test, and 2 weeks later, they had a positive test. And then they looked at everybody they came in contact with. And at that 2-week mark, not a single person who they came in contact with caught the virus. We don't recommend people get retested. because that virus can stay there either in a non-effective form or dead for a very long time. And it creates all sorts of problems because, you say, okay, I'm getting better. I want to see if I get it cleared. I get in the swab. Oh my God, it's still there. What do I do now? Well, I feel fine. Do I still have to stay locked up? The answer is no. But then your boss goes, wait a minute, you got that positive test. No, you can't come back here till you get a negative test. And particularly when we're looking at crucial businesses, like first responders, hospital workers, those sorts of things, or even just people that are out, in the tourist industry and people are coming down and you need people to run your business. You don't need to tell people that they need to get a negative test. As long as they're feeling good and they have that time period, that 10 and 3, then they're good to go.
Okay. That answers pretty much every question that I had. Someone actually reached out to me and said, hey, can you ask this? I said, of course I can. So if you're watching on social media and you have any questions, feel free to ask right now. And right now we're talking to Dr. Philip Keiser, the Galveston County Health Authority for the county. So he is the man to ask for all of these questions. One thing we spoke about earlier was the ICUs potentially being full, and I can speak on that as well. My wife, she started feeling bad. We started calling doctors. They said, don't come in. We ended up finding a place. It's Emergy Care off of Falcon. Shout out to Saul Balderas and Little Saul Tacos, and he's the director of nursing there. And he got us in, and got a test. And then she started having some pain, and so we went back to that place because none of the doctors would see her. They were trying to find a hospital to take her to, and we couldn't find one. They were calling like all of them, and they were all full. That's the case, right? The hospitals are they're filling up.
Our hospitals are getting full. I think Houston is probably worse than we are. Harris County, they probably are. They don't have as many beds as we do. Our hospital beds are getting full. The real problem, believe it or not, isn't so much the beds. We have ability to expand those beds. We have the beds. We have the equipment. It's getting the nurses. And as you might guess, if you're an ICU nurse right now, you're in high demand. And so, we put requests in for the state, and people are being reassigned so that we can help meet the need as we see it arising. The other thing we're doing is that we're trying to shorten hospital stays for everybody. So if there's something that you came into the hospital for a procedure, and normally you stay 3 days, but you're doing okay at 2 days, well, you can go home. And so it's a very big balancing act right now. We have not been overwhelmed yet. We have not been overrun yet, okay? And I think we're about as prepared as any place can be. The nice thing about it hitting us now as opposed to April or the first part of May is that we've had time to prepare for this. And so we're about as ready as anybody can be. So we don't want people panicking or worrying they can't come to the hospital. We want them to come to the hospital. And, if you need to get hospitalized, somebody's going to find you a place to stay. But we also want people to say that to stop this thing like, oh, this is not a big deal. It is a big deal. And it's beginning to come to fruition. I'm really worried about the next couple of weeks. I think the next couple of weeks are really going to tell us whether all of the things that we've done have made a difference. We've got a glimmer of hope. The numbers are beginning to shoulder off. And if we can sustain, and if we can see that kind of round off and flatten the next couple of weeks and then start to go down, we'll be okay.
So is that the message? Because at the beginning we heard a lot of let's flatten the curve so we don't overrun it. And then we started to open up stuff maybe too soon because the numbers started to go up. So what's the message right now?
The message is that people need to be really very careful. If you don't have to go out, don't go out. When you do go out and about, wear a mask. Be cognizant of your surroundings. I think that's probably the most important thing. Is people go out and suddenly it's like, oh, I'm free and I don't have to worry about anything, and that's not the case. You have to go to the grocery store. People have to eat. Some people want to go to restaurants. I can tell you, I've gone to restaurants, and some of them I think are doing outstanding jobs. All right, some of them not so good. And so if you go to a place and you feel uncomfortable, it's okay to leave. We should reward those businesses that are doing good jobs at trying to protect us. And don't go into situations where there's crowding, where you see things where there's not social distancing, where people are not consistently wearing masks. Need to take a step back. We're really struggling right now to find that sweet spot between having people die from COVID and having the economy adversely affected so that bad things will happen. If we don't continue, just even as a hospital system, if we don't continue to take care of everybody that needs to be taken care of, the hospital won't make the money it needs to survive, and then the hospital won't be there, right? And that's, everybody's in that same boat. So we need everybody to cooperate and be mindful of what you're doing and be careful about what you're doing.
So here's a question. This one is from Kimberly, and she's watching on our Facebook stream. She said, I have a dad that's 93. He lives with us. What do I need to do something extra to help or to be careful? She said she's a hairstylist and her husband is a waiter.
Yeah, that's a tough situation. My mother-in-law is 88. She's got cancer and she's staying with us. And so I feel for that situation. I think there are a couple things that you can do. Is the first of all is, there are guidelines for hairstylists on how to do things. Just be obsessive about how you do that. And also in the shop, look for choke points, right? So much emphasis has been on, this is what you do when you're cutting hair. This is how you walk this individual through. But look at where people congregate, at the door, at the desk. Do you have too many people sitting around in the waiting room? Those are all the areas that are vulnerable. As a waiter, again, make sure you wear a mask. It's okay to stand back a little bit as you're serving food and making sure that you're not getting too close to people. Look at what your employer's doing. Are they really at the right percentage? Do they have enough space between folks? And if not, you probably ought to talk to your boss about that. And if they want some guidance, we would be happy to talk to them about those things. When you come home, again, wash your hands, be careful about, where you do and what you do. And as much as possible, talk to granddad across the room instead of getting up close. I know it's hard not to hug him, but as much as you can until we can get through this point. We're at a very crucial point right now.
What about cleaning, like your house, groceries, stuff that comes in and out? What can you do to take proper measures? Yeah.
So the most important thing is your hands, right? And so think about where your hands have been. Make sure that you're constantly hand sanitizing your hands. I would say if your hands aren't a little chapped and you're working in public, you're probably not doing it enough.
I'm chapped all over.
There you go. Yeah. Right? And then the second thing is surfaces that people would touch, doorknobs, door handles, those types of things, for waiters and other people that are dealing in public where people are been make sure you're wearing gloves, but also be careful about how you take those gloves off, So the proper way to take the glove off is the one glove on, you pull the top and you pull that off, and then you slip your hand underneath the other one on the inside, pull that off, and then wash your hands immediately. So that way you don't transfer things to yourself. Wash down surfaces where anybody's coughed, or if anybody's had any accidents, make sure you wash all that stuff very well. The most important thing is that you don't need to use any special hand sanitizer for cleaning things. Soap and water is just fine.
Okay. Here's another question from social media. What is your assessment? Does it support for schools opening in the fall? What do you think about that?
Yeah, well, we've been waiting for both the federal government and the state to give us guidelines on how schools should open. They've come out with those. And we're actually talking to the school districts about what things are going to look like. And it's very hard to come up with a blanket statement, because what we found is that each school district is different. And not only that, each school itself is different. And the physical plant has a lot to do with what kind of measures you use. There are some schools where they have lots of space and it's easy to break the classes up and not have kids move around. There's others where that's not possible. And then also again, the areas that are the most vulnerable, coming into the building, leaving the building, is there ways that you can do that without crowding? Some of the things that are on the table are having staggered school days, having partial video versus partial class. And then, of course, this is the one thing I know a lot of parents aren't going to like. Don't send your kids to school sick, all right? Your kid's sick, keep them home. That's going to be crucial. And I think what you're going to find is that the schools will have zero tolerance for that. They're just going to say, your kid's sick, come here, pick him up right now. And I think they all understand that. And then what we'll do is we'll also work with the schools, so when they have outbreaks, and I expect that we will see some outbreaks in school, is to figure out who those kids are, isolate them real quickly, and then talk to the families and make sure that the families are okay and they're all getting tested.
Are kids handling it better, coronavirus?
Generally, yes. That most kids do not get very ill from COVID. Some of them do. It's very rare. There's this inflammatory syndrome that occurs with kids, and a very small number of children, they actually can have inflammation of their heart muscles. And so it is something we worry about. But as a general rule of thumb, this doesn't affect children the way influenza does. It mainly affects older people.
So speaking of the fall in school and kids going back, is there potential for this to continue to mutate and either be, more deadly or less harmful?
Yeah, no, that's a good question. We don't know the answer to that, and it would just be speculating. Either one of those could happen. The way things are going right now, I expect that we will have this through the fall and through the winter. One of the big questions comes up is, well, what happens if flu comes around at the same time? And then it's like, that could be really bad. But we just don't know what's going to happen with that. Everybody's hoping that we can get a vaccine relatively soon, although, for everybody, it's not going to be soon enough. I can tell you that. Probably a vaccine in the fall is not realistic, probably looking at winter at the very earliest.
Okay. And then I guess the other thing people are looking to do is to go back to like concerts, entertainment things, and even not just that, but like fundraisers, like nonprofit events. There's a lot of stuff that's been
we're going to have to figure out different ways to do this, and churches are going to have to figure out different ways to do this. I mean, clearly people standing together and singing is a really great way to infect a lot of people. And that's the problem. And so, we're going to have to figure out ways that we can do this where we can socially distance. Some congregations have, some churches have venues that are big enough to spread people out. Alan Jackson did a concert where everybody came in a pickup truck, and all the trucks were kept 6 feet apart, and everybody sat in the back of their truck and had a good time, and they were outside, and that's probably okay. So I think what we're going to see is we're going to see some very creative solutions to try and mitigating this. The demand for the entertainment and our culture and our life is not going to go away. People aren't just going to stay locked up for the rest of their lives. And so we have to figure out ways that we can handle this until we can get this under control. But I don't expect to see anytime soon having a big concert venue open up and everybody crowding inside. That's just way too dangerous at this point.
This is KHEA Radio, 99.5 FM. I'm talking to Dr. Philip Keiser. He is the Galveston County Health Authority. Dr. Keiser, what treatments are we seeing being used, and is there one that's proving to be the most effective?
Yeah, so there's a medication called remdesivir, which it's technically still experimental, but it's pretty widely available, and the FDA is letting us use it. And we have so far we have good supplies of that. We get a shipment like about every 2 weeks, and we've been using it. And I think it does make a difference in people, particularly if we can get them relatively early on, sick enough to be in the hospital, but not so sick that they need to be in the ICU. And then for people that have other complications that are due to the inflammation that COVID causes, we use drugs like dexamethasone. It's a steroid, and it helps reduce the inflammatory response, and that's having some effect. We've learned some hard lessons. We've learned not to put people on breathing machines or ventilators too early, because that actually can damage the lungs. And with this particular disease, with other diseases, it's actually good to put people on early. With this one, not so much. And so we've learned not to do that. We've learned that if you basically have people lie on their belly and let everything drain out of their lungs, that's helpful. And then finally, I think probably the most important thing is our healthcare staff is getting experienced, and they're seasoned, and you can't put too much value on that. Just learning how to put it together in a way that works for people is really very, very important. And so I think we're beginning to see chipping away at the mortality. We don't have a drug like penicillin where you just give it to people and it goes away. We'd love to have one, but it's just not here yet. So we're working with what we can, and I think we're better at this than we were 2 months ago.
Here's another question. This is from Jennifer watching on Facebook as well. She wants to know how far back the antibody test is showing for the COVID-19 antibodies.
Yeah, well, we know that at least 3 months. We know that for sure because, again, with that aircraft carrier, they measured antibodies on sailors that had been infected 3 months before. We don't know how much longer it'll go. The antibody test that we're using, at least at UTMB, is pretty darn good. And almost everybody that we've tested that had the swab test positive later developed antibodies, unless it was very early on in their infection. So if you're curious and concerned, you can just call and schedule an antibody test. The number's on Judge Henry's website. It's also on the Galveston County Health District's website. If you go to gchd.org/testing, you'll see a number there that you can call for testing and telling you want an antibody test. It's at no charge. If you have insurance, they'll charge your insurance, and if you don't, Judge Henry's office is paying for it.
Okay, here's another question. This was actually from my wife, just in conversation that we had the other day. She was wondering about any long-term effects that coronavirus may have on somebody. Do we know any?
Yeah, well, that's a good question, and we're learning about it. We certainly know that people who have been really sick and have been on ventilators have problems with their lungs. We are seeing that some people have developed problems with their kidneys. Usually that occurs in the acute illness. It's not something you get sick and then later on down the line something bad happens to you because of it. We're seeing a lot of people who are having a lot of fatigue, and we're learning about this. There's discussion about setting up a chronic COVID clinic, or COVID recovery clinic, I should say. So that way people who have been sick, they can go there and be monitored and have their issues addressed, and also help us learn what the long-term effects of this are. Because quite frankly, we've been so focused on the people that are acutely ill, we really haven't had a lot of time to follow people up over a long period of time. And it may be that we find that in some individuals, there are some very long-lasting effects. For most people, the average person who gets a little sick, we don't think so, but time will tell.
Okay, here's another question. This one's good, but can you get it more than once? If you've already had it, you tested positive, maybe you had the positive antibodies, can you catch it again?
Don't know. Not in the short term. So, probably not in 3 to 6 months, but could you get it 6 months later? Maybe. We just don't know. We know you get antibodies. We know these antibodies are what we call neutralizing. That is that they kill the virus. We know that that with other coronaviruses that response wanes after a period of time. That's why you can get colds year after year, right?
Mm-hmm.
And because this is primarily a cold virus. But what we don't know is how long this lasts. We don't know if you can get it again, whether you'll get less sick. Maybe you'll get more sick because it creates a lot of inflammation. Maybe it doesn't last that long, but a vaccine can boost it. I mean, there's just so many unanswered questions, and we're really not going to know about this for probably another 6 months. But so far, there have not been any real credible stories of people being reinfected.
Okay. So we've mentioned vaccine a couple times, and I've seen a lot of people being very wary of a potential vaccine, saying I am not taking it. But I also saw, I believe it was I-45 now, I'd put out a post, I think somewhere west of Katy, was looking for participants in a trial run for a vaccine.
Yeah. And you're going to see more of them because everybody's racing real hard to get a vaccine. And what the federal government strategy is that they're actually allowing multiple vaccines to be tested and tried because they want to find the best 1 or 2 or 3 that they can actually put forward for the general public. So you're going to see a lot of people being requested to be in a vaccine trial.
How safe is that for like if I wanted to participate or somebody, is that safe for them, you think?
It's an experiment. I'll be very honest with you. There's no guarantee of safety. For the most part, people do okay with the vaccine trials. But anytime you go into a research trial, there is no guarantee that it will be safe to you. Some people are willing to take the risk out of altruism. Some people just look at the numbers and go, this is going to be okay. And they're usually right. And some people go, I don't want to do this. This is not for me. So that's why we don't compel people or force people to be in studies. We ask very nicely, and if you say no, we say, well, thank you for listening to me, and move on. But it's not something where you can make people do it, because there are just too many unknowns with that. So we don't know. And, when a vaccine comes out, will the vaccine be safe? By the time it comes out, we'll probably have a lot of information on how safe. And then we can tell people very clearly, we tested it in 1,000 people. X number of people had this symptom, X number of people had this. And for the most part, everybody did okay. So we'll have the safety data at the time that the vaccine comes out.
Dr. Keiser, is there anything else you'd like to share, or just remind people why it's important and what is important? What should we be doing?
Yeah, well, I think it's I sound like an old saw. I guess I sound like your grumpy old dad telling you to do stuff. But it goes back to the same things again. This thing is real, and we're beginning to see the consequences of it. We did a very good job in April and May in flattening the curve, so we didn't see lots of people infected. When we opened up, everybody was just so tired of being locked up that they didn't follow the guidelines, and now we have lots and lots of cases. And so it's very important. Follow those guidelines. Wear a mask. Wash your hands. Socially distance yourself. Don't just do it for you. Do it for your family members. I can't emphasize how many times we've called up young people, and when they tell us, well, I went home and I did, this with my family after getting it, and then we test the family, and almost everybody in the family is positive. One person, and then there's 15, 20 people positive, and that just keeps happening over and over and over again. So it's not just about you; it's about everybody that you know and you love. So be careful.
Thank you so much for joining today. I appreciate you taking the time and just answering the questions, and I know everybody else appreciates it.
Well, thank you for having me.